years and care for children and adults with special needs. Today, I'm here as a representative of my profession, as a constituent of the state, as a parent, as a small business owner, and as a member of the Connecticut State Dental Association, which represents 88 care providers in Connecticut. I'm here to offer my expertise and real-life experience in favor of House Bill 6832 regarding prior authorization. But I request that my testimony also be included into the record for SB 6. Prior authorization is approval to administer oral health care services from insurance companies, and this assures us doctors that patients are not only in agreement with the treatment plan, but so are their insurance companies. Unfortunately, what should be a simple, comprehensive system of providing care and getting approval and financial guarantee has become complicated and a disservice to many of our patients. In pediatric dentistry, I encounter this issue when I have young and special needs patients with decay so extensive that treatment in the operating room under general anesthesia is the only safe and humane way to treat. In the operating room, all the work is completed at once, which could include extractions, nerve treatments, and fillings. We always submit prior authorization because the cost of doing all the work at one time can be very expensive. Recently, I treated a young man with severe anxiety and decay in 20 of his teeth, some that were so bad that the teeth needed crowns and had so much decay that they required being pulled, in addition to the fillings that I recommended. His decay was causing him so much pain that he couldn't eat or sleep, so treatment in the operating room was the only way to proceed due to his anxiety. We submitted prior authorization to his insurance company, but after the treatment was completed, his dental insurance ended up leaving the family with $2,000 of unexpected costs. In this post-COVID world, few people have an extra $2,000 to spend. And due to his psychiatric issues, his family was already in debt. And recently, just last week, I received notice that they filed for bankruptcy. So you can see this is a real burden on our patients. It is cases like this that has brought me here to urge you for the support of prior authorization, and I'm happy to answer your questions.
Thank you very much for your testimony. Any questions? Senator Marks.
Thank you very much for your testimony. I have a special place in my heart for pediatric dentists and for pediatric oral surgeons, as my youngest daughter had a cleft lip and palate. And her very last surgery, her Lafort surgery, where they pulled out her jaw, I'm sure you know all about it. The only reason I got that covered was because I had a daughter in med school who was very political, and she was in Washington, D.C., and she marched over to Senator Blumenthal's office, and his aide worked on it all day long to make sure we got that, which was initially covered. She had about $10,000 of orthodontic work. And then afterwards, the day before the surgery, they told us that no, they were not going to cover it. So I got it covered because I have privilege and I'm tenacious and my daughter is tenacious, and we just know how to work the system. But that should never happen. And I know the patients as a pediatric nurse. I know the patients that you are talking about, and that the tooth decay and the problems that they have with their teeth, and what it does to families is terrible. So I want you to know that I will fight for you. I will fight for the pediatric dentists and the oral surgeons, and that no family should have to go through getting denied after something has already been approved.
Thank you. And I agree with you 100%. I'm sorry you went through that.
Thank you, Senator. Any other questions? And online? Thank you very much for testifying today. We appreciate it.